again on Dodgy Git. It's Dodgy Git Show 114. This one, we're going to bring you part 2 of this day 2 of the COVID inquiry. We're waiting for them all to come back again. They won't be long. They just popped out to the loo, and they got a cup of coffee and that, ain't they? And they're going for a smoke out the walk 400 million yards to the smoking shed. They're all bundled under there with the judge, having a smoke, aren't they? What do you reckon? Something like that, isn't it? Anyway, I'll transition you back over. There we go. Look, nicely. We're up to date. We got a sound on. We're just waiting for Mom. What do they call it? Her Honour to come back again. Her Honour will be back in a minute, and she'll say, "Oi, get on with it," and they'll start questioning him until lunchtime. Yeah, I hope you can stay with me. I hope you've seen my first edition. I'm just checking up if it came out on my Dewberry, whatnot. Yeah, part 4 yesterday had a few views, not many. I think my numbers are suppressed. Yeah, I do. I've got some funny feeling. I've got a funny feeling there. It don't end up going through. What are we on? Yeah, we are live. That's going. It's all going. Why is it not coming up on this thing again? I wonder. Oh, there we go. Look, didn't drop off the end. Oh yeah, they got some there on that one. God blimey, that was an hour and a half. Yeah, she'll probably come back. We'll do another hour and a half. They're probably all shuffling in the room now and all sitting down. Yeah, they're only given 10 minutes. They're all queuing at the bog, so there'll be a log jam, right? But going in there after Boris, yeah, that he's shitting himself. Fucking hell. Yeah, Boris. What do you reckon? What do you think about what he said? What do you think about the questions that have been asked? What do you think about the intervention from the judge? What's happened in your life, if you've been affected by it or not? I know there's lots and lots of very, very angry people everywhere with all kinds of different situations they've had to deal with in regard to decision making that's been made by our government. And when we say government, we expect them to be a group of people, a team, that is the country's wisest, people that want to build structure to what they're doing and will have the skill to say stop, no and don't. This is the thing, it's about awareness. You can see it going on. Do you stop it? Do you mention it? Do you speak up? Yeah, stop and speak up. Yeah, it's one thing we used to do. What was the other one? I'll see if I can find another one. So, stop and speak up. Oh, yeah, there you go. Yeah, stop and speak up. Yeah, on a pen. I used to have that on pens. Yeah, there was a few others. I can't remember them because I've lost the pen. Or people have nicked them. Yeah. Let's have a little refresh. She only said 10 minutes, didn't she? She did say 10 minutes. I suppose cool. She can do what she likes. She wants to freaking spend 3 hours in the smoking shed. She can, I suppose. A lot of people watching. Out there. What we got? Almost 6,000 people watching the main feed. Yeah. All sat there waiting. Actually, let's see, you can't comment or chat, otherwise I'll tell these people. Yeah, comments are turned off. Otherwise, I'd say come over to the Dodgy Git Show. See, watch the Dodgy Git Show. We can. We've got live comment, live chat open. Yeah, comments for full time after use thing down the bottom there. You can write a comment. Not like them. They turned everything off. Yeah. Stupid, isn't it? Turning it off. You don't get any feedback. You ain't got no feedback. You don't know what anybody's worried about, and then you can't change anything that people are worried about, right? That's the fucking whole point of it. That's why somebody fucking puts their head above. It is. It's what they used to say in the old days, when it keep your head down, yeah? But if you're pissed off, you will fucking stand up and put your head above the parapet. And you don't mind fucking trying to dodge a few bullets, as long as you get to fucking say what you need to say, because you really need to fucking say it. Yeah? I mean, it is a case of that. We need to fucking say what needs to be said. These people, these decision makers, like I said, go and watch part 1, please. Repeatedly in it, I'm repeatedly saying Chris Whitty's name, because I can't see who else is influencing everybody within that building. You've got Half Dick there. He's too busy fucking what? Stiffing powder and fucking girls. Yeah? You got, what's his name? What was his fucking name? Cummins, Dominic Cummins. Yeah? Well, had he had a line of fucking what's his name's fucking Scooby? Here we go. Welcome back, everybody. Dodgy Git Show, Day 2, Part 2. Boris and the COVID
Mr.
inquiry.
Johnson, the tier system.
Yes.
Thanks for joining me, everybody.
Thank
I'll
you.
shut up.
Briefly, you received advice from the COVID task force on the 7th of October, just to put this in its chronological place. There was a discussion in the in number 10 that day about regional lockdown measures.
Ooh, regional lockdown measures. We had
a major
discussion.
meeting on the 8th of October. Yourself, the Chancellor, CMO, GCSA, and the Chief Executive of the NHS, Simon Stevens. The evening notes kept by Sir Patrick Vallance talks about the somewhat desperate nature of the anxious nature of the decision having to be made by you, and the issues which you've ventilated, which were troubling you. The evidence from the COVID-0 meeting of the 11th of October is that the government chief scientific advisor made plain, because he says it in terms, that the level 3 baseline, that's to say the standard level 3, but the highermost level 3 level, was highly unlikely to bring the R below 1, and so highly unlikely to control the growth of the epidemic. Is that why you said earlier, and you've said it in your statement, you felt the tier system was nevertheless worth a try? There were doubts expressed before you even announced it as to whether or not it would work, but your assessment, and it was ultimately for you to decide, your assessment was it was worth the shot.
It was, and it wasn't just my assessment. I think that even after that meeting, as I said earlier, on the 20th or so, you've got continuing scientific corroboration of
20th. He was talking about the 8th, wasn't he?
Rationale behind the regional approach. But
it'll be raining soon here.
What we wanted was, of course, to try to stamp on the virus, to wallop it wherever it was most prevalent. The difficulty was that it was very laborious and it involved some very difficult negotiations. Understandably, with areas that have been in restrictions for a very long time, and their leaders, understandably, wanted proper financial help, and to get the tougher measures put on was proving, in a voluntary way, was proving time-consuming and costly.
So,
is it right to say that there was continuing scientific corroboration for the tiers? The material in COVID-0 was to the effect that even the highest level, level 3, would be unlikely to work. Sir Patrick Valence's notes make plain that at that meeting, he felt he's being asked to approve measures knowing that they weren't enough. And the public health epidemiological support appeared to be quite slim. However, the scientists and the public health experts recognised that the public health issue was only one half of the debate. It was for you to weigh up the many issues that you've described, including the economic considerations, and to balance them. That wasn't their call; it was your call.
Well, I had to balance them, but there were two things. I think it was so. I was fortified by what I think the CMO said in the cabinet of October the 20th.
Chris again.
I'm fairly certain that he said something,
It was Chris, wasn't it?
JVT said something at about the same time.
Oh, right,
to the
it was
effect
Chris.
that a regional approach was still reasonable. What we wanted out of the tiering system, and we've got to be clear, we didn't achieve it, was really to crush the virus where it was most prevalent. And I've explained that one of the difficulties was, getting local leaders to put in measures fast enough. I think it's possible, and I think that there's even some evidence from Patrick that we had a fighting chance of getting the R below 1 if we'd been able to get some of those measures put in harder and faster in those areas. I think it might have worked, and there are other people who think that too.
The point, Mr. Johnson, is you can't rely upon what was said on the 20th of October about the general nature of regional restrictions, because you made the decision to go for tiers on the 11th of October, over 8 days before, and the announcement was made on the 12th of October.
Yes, but
what was said subsequently on the 20th of October in relation to the merits of regional restrictions can't be relied upon as a justification for your decision making 10 days before.
10 days earlier.
With great respect, I think what it shows is that
Is he fucked up, Boris?
Around that time there was continuing scientific support, as I took it.
Chris, again,
I'm just giving you what I felt.
From where the only person that's coming up with that is
support for
Chris.
a continued regional approach. And by the way, it was also my feeling that although the suggestion from Sage had been for a circuit breaker, I didn't feel, listening to the arguments, and this may have been my mistake, but I didn't feel, listening to the arguments, that the pressure for a circuit breaker was particularly strong, and that may be my mistake, but it wasn't coming from the health secretary, and it seemed to me that there were countervailing arguments as well.
In the event, the tiers, as we know, didn't work.
Well, they didn't, and
They created a lot of fucking tiers,
I'm very
didn't they, the tiers?
sad about that, but I think
you're
that
sad,
they
are
were
you? Fucking hell,
logically,
Boris, come on,
rationally,
mate.
as we came out of
Fucking sad about
the restrictions in the summer, they were worth a try. The trouble was that they became very invidious as between areas, because one village would suddenly find itself in very heavy restrictions, and the village next door was not, while the incidence of the virus was exactly the same.
And everybody went to the pub.
Politicians of all kinds became very worked up, sometimes quite paranoid about the tiering approach. It clearly was proving divisive and difficult.
Yeah, because some people were going to dental appointments on trains with their
Lister,
wives and all that
who was
shit.
in charge of the negotiations, did a heroic job in trying to get government to local government to regional government to agree.
And in addition, the evidence would appear to suggest, of course, as ever, a matter for my lady, that not only were there problems that you've identified, Mr. Johnson, but as Mr. Ridley has said, the process overall was entered into extremely quickly, which gave rise to problems of its own.
Yeah.
The negotiations were difficult.
Those
and
girls just
prolonged,
swapped spaces.
And of course, when dealing with
What the fuck
epidemiological
just happened there?
exponential
Yeah,
growth.
They just changed his
the virus
background.
isn't interested in all this. And the virus
Indeed. And also, logically, because the virus was spreading, ultimately, as proved to be the case, it spread to all areas, and therefore there was a level of, there was a degree,
just swapped
it's been described,
places.
epidemiological levelling up. everywhere
I'm glad
would
I
have
made
to
this
eventually go
video.
up into tier 3, and that would, of course,
There's
defeat the
some
whole
proof
purpose of
there.
it.
It's a green
That's
screen.
completely right.
All right.
That's a bit sus.
I think that's a
How many
big
minutes
question.
in are we?
Mr. Hancock
15
told
minutes
Inquiry
in.
that he knew on the 14th of October when you announced, the 12th of October when you announced the tier system, that it wouldn't work. Did he tell you that?
Not to my knowledge, not that I can remember.
We then come to the lead up to the second lockdown. It does appear that
The background's made up because the girls.
COVID Task Force provided a forward strategy
different
document for you on the 25th of October.
Okay, fair enough.
And there was a meeting in Chequers to discuss
Yeah,
it.
because that girl there with the
You
nice
then
hair in the
received
bottom right.
a further
She
task
changed
force
the
advice
seat
on
with
the
the other girl, I
28th
thought,
of
but it's not.
October.
There's 3 of them sat there.
And then another paper for a COVID-0 meeting.
That's
And
nice.
then there was ultimately a meeting at which
Kick my
you
ass.
decided
She'd
that
literally
there had to
kick
be a
me.
lockdown. And my question is this: why were there a number of papers and strategy documents given to you in the same week, all broadly recommending a lockdown? It rather looks as if the COVID task force was trying to bring you to a particular conclusion.
I don't know the answer to that. I do remember the papers, and I think it was a James Bowler paper that I got on the 28th, for instance. There was
28th?
there was
That
a
was
lot of
10 days after.
The COVID task force, by the way, was
No, it was
determined
20 days after, wasn't it?
to make
20
the
days
tiering
after, yeah.
system work. They thought we began full of hope that it could work, but it was clear by
3 weeks
the end
later.
of the month, towards the end of the month, that it was just running out of road.
Let me be more direct. Mr. Shafi's notes of a meeting on the 25th of October, the forward strategy meeting, record you as recognising that the country was in a very tough spot. You say, according to him, that you're deeply sceptical about a national lockdown, and you say, we're not, or I'm not going to be stampeded into a national lockdown yet. That's over the weekend. Then 3 days later, the task force comes to you and says that the situation is continuing to deteriorate. We don't think the tiers are working. There's got to be a lockdown. And the point I made to you is to what degree, if any, do you assess that the COVID task force was trying to impose on you, or in trying to recommend a lockdown because it was aware that you had already said on the 25th, I'm really not going to be stampeded this time.
Yeah, but it was quite right not to be stampeded into any course of action. But the virus, irrespective of the COVID task force, the virus was spreading, and it was spreading exponentially, and that was clear from what James Bowler had to say, and that was clear for a long time that it was spreading in areas where it had seeded. We wanted to try the tiered approach. We wanted to try the local approach. That was gradually running out of road, and we had to go for national measures. But I always knew that that was on the cards.
Having tried measures which didn't prove to work, having been told from July that a second wave was inevitable, do you accept that there is at least a good argument that the tier system should have been conceptualised and put into place earlier, at a time when the prevalence was lower, and therefore the tier system may have been more likely to work, so for September? Alternatively, that a circuit breaker should have been applied in September so as to avoid, possibly, and we will never know, possibly the second devastating national lockdown which you were forced to apply.
So on the point about the circuit breaker, I think we've been round that quite a bit. There were arguments for and against. It wasn't actually presented to me in as something that we urgently needed to do. It was an option.
Everyone.
The health secretary was against it, and there were clear downsides because of the problem of bounce back. And as I say, a circuit breaker just flipping things on and off. It's a very massive intervention. You've got to get it right, and
like a lockdown.
And it's a complete lockdown. So and on the your point about tiering, should tiering have been introduced earlier and formalised earlier, which is I think what you asked. That's an excellent question. I think that the truth is that we already, for a long time, had a kind of tiering, in the sense that some places remain. Leicester, the northwest, remained under measures for a long time. It took a while. I'll be honest. It took a while to work out the LCAL system and to work out how to move places up and down. And I think one of the lessons of the whole experience is that when you set up these artificial boundaries between epidemiological areas in using council boundaries or whatever, you're going to create huge problems and or parliamentary constituents. You're going to create huge problems, and we ran into those. And I say in my statement, I don't think that it in the end worked, but logically it appeared to be the right way to go as we came out of the first lockdown.
And do you accept, Mr. Johnson, that the position that was ultimately reached was that you did have and you imposed a roller coaster lockdown process overall? Epidemiological evidence has been given to this inquiry to the fact that if you impose lockdown, circuit breakers, whatever they may be called, earlier, there is a greater chance you can get on top of the virus earlier. You then don't need to have such a long circuit breaker or lockdown. And when you come out, prevalence is likely to be lower, thereby obviating the need for yet another lockdown.
The answer,
if you just let me put the question. The evidence suggests that if, however, you wait to the last minute before imposing a lockdown, you have more of a pronounced roller coaster approach, and prevalence is unlikely to be as low as it would otherwise be, and the lockdown, in order to work, has to be longer, harder, and more brutal.
Right.
That's what you ended up with.
No. So a lot of points there, if I may. So first of all, we didn't delay and then do something at the last minute, as though there were. So neither in March nor in September, October did we do one single lockdown. And I think this is one of the most important points that people need to remember, because it's been slightly forgotten. In March, there are a crescendo of measures beginning in I think on the 9th, when I first told people to avoid contact and so on. There's school closures, hospitality closures, non-essential retail closure, and so on. Then the lockdown on the 23rd. When it comes to to September, October, again, there's a series of steps that we take nationally in addition to the regional measures. Now, and I've described them: the 9th of September, the rule of 6, the 22nd of September, working from home curfew, so on, so on. Then the tiering system, then lockdown. Now, the question.
But they're all compounding each other at each point. But who's it being fed from?
Helped depress change the shape of the curve.
Being influenced
I think that they did. I hope that they did. I believe that they did. But epidemiologists will have, and I think it's one of the most important things that the inquiry has to evaluate, in my view, is the exact extent to which those NPIs deflected the progress of the virus. What I also think is that if you look at what happened, particularly the second curve, the second wave, it's very interesting that the first it's the two parts to it, and the first wave you can see that the collective impact of what we're doing from September onwards, because we're following it very closely by this time, does bend the curve. And again, I'll leave it to you to evaluate the exact extent to which that worked and that happened, because that's the crucial thing. We need to explain it properly. But then what happens, as I said earlier on, is that you get alpha, and that we hadn't budgeted for. And that's why the second curve describes the shape that it does.
And would you just explain what the significance of alpha was in terms of its additional transmissibility?
Yes, well, alpha is alpha is the Kent variant, which was identified in early December. I don't know why we called it the Kent variant. It didn't originate in Kent, but it was much more transmissible than the original coronavirus.
Really?
To a very large
Really?
extent.
How do you know that? Who told you that? Where's the evidence for that? Why didn't that spread? What's the spin-offs of that one? Ain't seen that. Anybody covered that? Not sure. Better grab hold of that with someone and fucking run with it.
Transmissibility meant that the government's room for manoeuvre was very much more constrained thereafter.
That's right. So when you talk about a roller coaster, I would say that roller coaster was very largely driven by nature. The extent to which we were able to control the roller coaster is something that I think we all need to focus on.
World's first roller coaster ever
The
made.
roller coaster was plainly evident from November, hence the lockdown. The Kent Alpha variant did not make itself plain until the first 3 or 4 days in December.
That's correct.
Yeah.
Though what's happened with the measures that we put in, as I said to my lady before, in that second wave, it actually looks, and I remember Matt telling me this, as though we've started to get the numbers under control again, and that was encouraging. And so it was unbelievably depressing when we got alpha.
There was a small margin for discretion, as far as you could see it, in December, because there was some way of trying to delay the more stringent measures that would be required as a result of the alpha variant. There was Christmas to consider.
Yeah.
Obviously, the prevalence level of the virus, the rate of transmission, was still relatively high in December, although the November lockdown had, of course, brought it down significantly, but not to the same level as it had been brought down to in May.
One with glasses on, the cooler.
And therefore, there was no possibility, was there, of opening entirely in December. There had to be fairly stringent restrictions applied, continued to be applied, whatever view you reached of the public health crisis. Is that a fair summary?
Yes. So our initial plan, as you know, was to open up on December the 2nd, which indeed we did. We then see our incontrovertible evidence of alpha, and we know we're basically heading for a full lockdown in January.
There was a debate, of course, about the degree to which you could ease, to the limited extent that you could, in December, bearing in mind your very clearly stated wish that as much could be done as possible to allow families to spend Christmas together.
We did have that debate, though. If you remember what happened, it just became untenable because
everybody went on holiday.
Alpha and London and a lot of the rest of the country went straight into Tier 4, as we called it.
Oh yeah, Tier 4. Was it?
I need to ask you, Mr. Johnson, to what extent your decision-making in the middle of December was influenced by the press or your backbenchers, because there are references in the Patrick Vallance diaries to you saying that the view of your backbenchers was to take a particular path. You were minded to agree with them. You appeared instinctively to resist the further reintroduction of the ultimate lockdown measures.
No,
Is there any truth to that?
It's certainly true that, as I've said before, that in the course of meetings, I would, as I thought was my job, and I believe was rightly thought was my job, I would
all the
express
sausage rolls.
the general view of not just of backbenchers,
Did you eat all the
but cabinet ministers.
Did you eat
who
all
might
the
not be
sausage
in that,
rolls, mate? It was your
meeting
fault, wasn't it?
about what
No,
we
you
were
never left
doing,
anyone
and
for
to try
anybody else.
to set up some challenge in the conversation.
On the 2nd of January,
Boris.
Michael Gove sent you a private note expressing his views, essentially to the effect that there was no alternative but to adopt a strategy of maximum suppression, as he put it. Did that note,
Boris could pay for everyone's
perhaps
lunch, right?
traversed well-trodden ground,
Like 10
change your
fucking
views
years.
as to what should be done on the 4th of January?
No, and we'd already basically knew that. I was grateful to Michael for his note, but we already knew that we were
Fuck.
again. We just had to take the toughest measures that we could.
How did the last minute change in relation to whether or not schools, as
Terrible.
opposed to secondary school, schools not going back at all, as opposed to just primary schools going back?
Were
It
private
was terrible.
schools
It was
locked
terrible.
down?
I mean,
How did it happen?
Children
it was
that
inevitable because
boarding schools were boarding schools shut down. What happened to boarding
if you
school
remember in
children during that
October,
time?
November
Nobody's
lockdown,
mentioned
we've
anything
kept
about
the schools open because of the massive detriment to people. You know, and it's always the most vulnerable families. It's the poorest kids who come off worst from school closures. And that was definitely the case.
You're a
We'd seen
private
that
school kid and your parents are fucking stuck in
the first
Dubai
lockdown,
and you're stuck in
without a shadow doubt.
abusive
So we
school.
were desperate to keep schools open. Yes, did I fight in my heart and head to keep schools open? Yes, I did, and I really wanted to do it, but it just wasn't a runner, and we had to lock everything down.
Why?
How hard did you fight in your heart and head, Mr. Johnson? I ask because Mr. Williamson says in his witness statement that when he and you attended the cabinet meeting on the 4th of January, he made clear that he didn't think, of course, he's the Secretary of State for Education, he didn't think schools should close again.
Yes,
If they
cabinet meeting.
had to close,
Yeah, not
then
cabinet.
they must be opened again.
It's
by February
cabinet
next term.
meeting.
And he says, I didn't have complete autonomy to make core decisions, especially those regarding school closure and school
Special family
reopening.
day. Yeah,
So to
funny.
a significant extent, the views of the Secretary of State for Education were overridden.
There were, and I
your
didn't think he was
cabinet
approved the
approved.
changes. And I listened respectfully to what
God, if I was
cabinet
saying
had to say,
cool,
and
I'd be asleep
many
already, I'm a
colleagues
little
who
kid.
thought that
What do
we
you
should
mean?
try to keep schools open, and I just couldn't. You know, the fact is that sadly schools are terrific reservoirs of the virus. And they,
Kids are
in the
filthy,
cold winter
right?
months,
Spread
they were
fucking
going to be
germs everywhere.
a big
That's why you
vector
had the
of
initial
transmission
thing of the
for
chicken
elderly
pox
people.
theory,
And
right? Yes,
it
exactly,
wasn't right.
Boris. Chicken pox, yeah.
Now, may we move forward, in fact, almost a year to Omicron
Yes.
in 2021.
Who gave it that name? Who was the first
Without going into
person
the
to call
details
it
of
that?
the somewhat arcane and complex
Why didn't
issue
it have
of
a
Plan A
number?
and Plan B
Yes.
and Plan B plus.
Oh, we'll have to. They're playing fucking
Was
silly
this the
buggers with
position
the fucking size of
from
the screen. I shut myself
the
over
beginning
now.
of December, or the end of
Try and
November and the
stop
beginning of
from-
December?
Yeah, see, now they change it back
The
again.
Omicron
Buggers.
variant became apparent.
Play silly buggers with the stars.
Steps you declared to Cabinet had to be taken to protect the public from the variant for good precautionary reasons. A plan was devised and put into place, which essentially meant moving from the pre-existing Plan A to a Plan B. And you told COVID-0 on the 8th of December that there seemed little option than to implement Plan B. The reality was that we were running out of road. The choice was to go ahead with Plan B or to wait and be faced with more concerning data and a rise in hospitalisations. Is that a fair summary?
Don't forget
I think that
yesterday,
sounds right, yes.
plan A was do
And
fuck all, Plan B was
What
do
was
something,
it that
anything
took place in the
was
course of the
suggested.
middle
Basically.
and later part of December that
Suggest
meant
it,
that you
give it a go,
didn't
here's
have
some
to go
money.
to Plan B plus, which was right back up to the more severe interventions. In fact, probably a level 4
that's
lockdown.
Right. Well, I think this was one of those occasions, possibly rare, when I felt that I got I was flattering myself, but I felt I'd got a pretty good handle on the data by then, and I was watching it.
Before you knew what the
very,
fuck
very
you were talking
closely,
about by then, you weren't
particularly
fucking sure at
the
all.
IFR
No.
in
I'm sure
in the Gauteng province of South Africa, where Omicron was very prevalent. And
where else was it prevalent? And who told you it was prevalent there? Who told you it was prevalent there? Who translated it into deaths from there?
Is a tragedy, but if the ratio was starting to diminish, as it seemed to be, then that was very significant. And so we were all, and I'm not claiming credit for myself, but we were all watching this very closely. And
who was feeding it in? Who was feeding you the data?
That it seemed to the data that we were seeing from South Africa seemed to me to suggest that Omicron was less deadly, and considerably less deadly. And I didn't know this, and I was very. I mean, Omicron was absolutely terrifying to be, because it was very transmissible, and there seemed a real risk that it would do a huge amount of damage to people.
Oh, really?
But
who told you that?
What I'm trying to say is that around about the middle, the end of that month, I start to think that maybe it's less deadly.
Oh yeah, where's Fauci, everybody? Where's Fauci today, yesterday, day before? Is he on another talk show?
That had to be the case, and we were lucky with Omicron.
The material shows, Mr. Johnson, that there were, as before, and you've addressed this issue, a number of bilateral meetings between yourself and the Chancellor Exchequer. And one in particular, we have an email concerning a readout of a meeting between yourself and the Chancellor on the 18th of December, makes plain that, quote, you seem generally undecided. You raise a number of points on each side of the argument. This goes back to your stated tendency to try to ventilate both sides of an argument. The Chancellor, according to the readout, said ultimately this is a decision for the Prime Minister, but he personally remained unconvinced that there was a compelling case for significant restrictions, and that is ultimately, of course, what you indeed decided. There's been an article in the press dated August 22, which suggests that at that meeting, the Chancellor came as close as he could, or used the closest formulation of words that he could to imply that he would resign if there was another lockdown. Does that accord with your recollection?
No, I don't remember that.
The debate, of course, continued in government to the end of December, and
I bet he does recall somebody saying that at some point.
You were presented with a paper concerning measures for January, and
Boris, you're under oath,
expressed your scepticism for those additional measures in your habitual way by using expletive across the paper to describe what you thought of the measures. And on the 5th of January, you told Cabinet it was time to grip the handlebars tightly, as the next few weeks would be bumpy, but the best option for the country was to get through the period without going back to restrictions. Is that correct?
That is correct, and I think that was entirely justified based on two things: what we were starting to learn about Omicron, but also, of course, on the vaccine rollout, which was by then, I think we'd vaccinated a huge number of people already.
Now, rule breaking. You supported Mr. Cummings when the Barnard Castle affair exploded in Easter 2020, did you not?
Need my teeth fixed,
I did.
The material, the suggestion is that Mr. Cummings drove 250 miles to Durham over the weekend of the 27th, 28th, 29th of March at the height of the lockdown with his wife and child, and Then on the 12th of April, he drove to Barnard Castle. He has said that you knew that he had moved his family out of London on that weekend of the 27th of March. You, the inquiry is aware, have said in a WhatsApp with another official that Mr. Cummings is a total and utter liar. He never told me he'd gone to Durham during lockdown. I only discovered it when the stories came out. He claimed he'd told me, but that he said my brain was so fogged by COVID, I didn't register. But it's not true. I would have noted it. He never told me. Is that the position you take today?
That's what I remember.
The position, though, was, of course, that public confidence in your administration, the United Kingdom government, not, I should say, from the data, the Scottish or Welsh administrations or the Northern Ireland Executive, dipped significantly. There was a very notable drop in confidence in the competence of your government. That obviously was highly regrettable. In the height of a public health crisis of unprecedented proportions, to have that blow to the public confidence in your government's competence was obviously damaging.
It was a bad moment, and I won't pretend otherwise. But actually, I think that what happened thereafter was fascinating in that whatever the rights and wrongs of the position I took on that episode, people continued to want us to get on with the job of fixing the pandemic, and they continue. In spite of what you say about the confidence factor, they continued to be more than willing to work together to defeat the virus, and that's what they did.
Is that right, Mr. Johnson? The same data which established the significant drop in confidence in your government, data from UCL called the Covid-19 Social Study, also appeared to suggest a drop in self-reported adherence to guidance. So there was not just you would say a communication or political or presentation issue, there was a substantive impact.
Well, I can't quantify that. What is certainly true is, as we've discussed a lot over the last couple of days, all NPIs start to degrade over time. Public adherence starts to fray. Whether that episode helped to exacerbate that problem, to the extent to which it did, I just can't judge.
The inquiry, as is everybody well aware, of course, that then the first reports of social gatherings in number 10 emerged.
Do you believe this,
in November of 2021. You were issued with a fixed penalty notice on the 12th of April 2022 relating to an event in Downing Street on the occasion of your birthday, the 19th of June 2020,
that was Boris.
Just a few weeks after the Barnard Castle affair.
Like
putting
said,
aside the issue of your own
views,
fixed penalty notice,
because they didn't believe Chris.
did you,
right?
and it's important I ask you this, did you apologise for the impression that had been given that staff in Downing Street take the rules and the regulations less than seriously? You, in fact, I think, described yourself as sickened yourself and furious.
I did, and I repeated that on many occasions.
But you acknowledge, of course, that all the breaches proved to have taken place, but the general behaviour took place in Downing Street on your watch.
I do, but I wish to just to stress, and I've always I've been clear for everything I've said. I take full responsibility for everything that the government said or did during the pandemic. I continue to regret very much what
wage
happened,
brings, mate, responsibility and
I
accountability.
really want to emphasise, and you talk about the impression, the version of events
Boris,
that has entered the
life
popular
on the
consciousness
inside
about what is supposed to have happened in Downing Street is a million miles from the reality of
Welcome
what
back to the
actually
Dodgy
happened
Kid Show, everybody.
in
Dodgy
number
Kid
10.
Show
And I speak
114.
on behalf of, I know of hundreds and hundreds of hard-working civil servants who thought that they were following the rules. And I know I don't
fined and told off and lost their job and arrested, and fucking held in fucking
by some of the
confinement.
Not just the media coverage, but the dramatic representations that we're now having of this are absolutely absurd. And
it's a clown show.
I want to report there a million
Welcome
miles
to
from the reality of what happened.
Mr. Johnson, one of the problems is that
Hello, Mark.
I've received a number of messages from bereaved people as I've travelled around the United Kingdom. And
she's Benson,
so many of them
Benson
suffered
girl, or reckon she's
horrific grief
like
during
L&B
lockdown.
or whatever
We all
it is.
know that it's
L&M.
far more traumatic even than
What do you reckon?
many other kinds of grief. And then I'm afraid Partygate has been called exacerbated.
Of course, and I totally understand their feelings. And
Yeah, mate, he was having a party, mate, and we weren't allowed to go and see Grandma.
Can I do? But again,
yeah,
apologise for mistakes that we made in number 10. What I'm trying to tell you and to tell the inquiry is that I think that the characterisation, the representation that has been of what civil servants and advisors were doing in number 10 has been a travesty of the truth. They thought they were working very, very hard, which they were, and I certainly thought that what we were doing was, as I've said before, within the rules. So that is in no way to
obfuscate the meaning of the language, right?
To attempt to mitigate the offence that has been caused, and I understand the offence.
Offence.
And
so, what is that offence? Fucking public assault.
And
what is that offence, Boris?
Time again, of course, I'd have done.
You tell me. You tell the judge.
In
tell the
number 10,
judge
and I would have sent repeated messages around saying, please, make sure that everybody can see that you're properly following the guidance.
How have you done that?
Frankly, I think.
You have a little discussion.
Some of
Don't
the
forget
witnesses
people
have
out there in the big wide world. Put it in the chat. Put it in the comments. How has he affected you?
But anyway,
Mr. Johnson,
I think people
you're
know
rambling, Boris. Shut the fuck up. Stop digging your hole.
It was a million miles away from the reality of Downing Street. One of your most competent and sterling civil servants, Helen McNamara, said in live evidence to my lady, I'd find it hard to pick one day when the regulations were followed properly inside that building.
But that's the point I'm making. Because
but you're the one, you're the captain of the ship.
That this was all
you're
about
the captain of the ship, and you was acting like a pirate.
Breaches of the regulations on account of
what if you look at
the formulaic obligations of walking
because I
down
believe
corridors
that girl,
and having to
that
work
lady,
in the
woman.
Building structure of Downing
if you read what
I think she was being harassed,
said
possibly sexually by fucking half dick,
I think actually that is what she was driving at. She says there was one meeting where we were able to do things strictly by the absolute letter of the guidance, and it was unsustainable, and that was why the guidance was written in a way so as to allow businesses to have flexibility.
Why? Who fed back? Who wrote out a feedback fucking occurrence report? Anything? No?
Forgive me, but
nobody wrote an occurrence report for that.
Situation in Downing Street, the conditions of
inability to stick to procedural
as the inquiry has
guidelines.
Heard, meeting after meeting after meeting, at all
missed the warning and the caution at the top of the document, Boris.
Succession.
Fuck me.
And summon people rapidly to different meetings. As Helen McNamara rightly says, in those conditions, it was very hard to follow the letter of the guidance, and I've tried to explain that many times. But I understand the offence that has been caused.
May we have 226239, page 13, please. This is around that time, the time in the revelation of the party.
Fucking revelation.
Partying in Downing Street.
She'll read a book in the break.
Communication between yourself and your cabinet secretary.
You see all that?
Your Cabinet Secretary, Simon Case, was originally obligated to carry out an investigation, but for a variety of reasons which we need to explore, he did not do so.
There you go.
But in the context of that debate at 23:04
23:04
on the 17th of December, Boris Johnson, in retrospect, we all should have told people, above all Lee Kane, to think about their behaviour in number 10 and how it would look. But now we must smash on.
Smash on, we playing
So
tennis
that wasn't
again.
about technical breaches of the regulations because of the planning in Downing Street.
It's all these
It was a reference to
references
behaviour,
fucking...
the behaviour of your officials and advisors,
It's like quotes to
and you
sport.
knew how it would look,
Pally, fucking...
but you didn't care that much.
I
get that,
did
Jovi,
care.
or try and
And
keep
to
it
say that I
light
didn't
and
care
talk
about what was happening generally is
People
the
don't like that.
complete
I did that
opposite
in emails.
of the
People
truth.
don't like that.
And
Start talking to them like a human being. They say, oh,
yes, I
not very
think that
efficient,
we
is
could have
it?
done more in number 10
You're
to
asking me if I was joining you for
insist
lunch.
that people thought about the way their behaviour would
Do you want
be
rank and number?
perceived by others. And I made this point
Fuck
repeatedly to the various inquiries that have been held already into this matter. And we should have thought about what it would look like to have people out in the garden when other people were not allowed in the garden, even though the garden was being used as a place of work. But the idea that I didn't...
We in the jungle, Boris. But you were,
in your line of
fucking
questioning,
Bora.
been,
Yeah.
of course,
Oh,
excellent
I'm
throughout.
being an
But
explorer.
you have...
Oh, yeah, there's the thing. What happened to that bloke?
You've dwelt particularly on
Whatever happened to fucking David
WhatsApp
Bellamy, huh?
exchanges and various things that I'm supposed to have said, which indicate that I didn't care. I did care, and I continue to care passionately about it. And I will, if you want, I haven't talked about this before in public.
Go on, Boris. Here we go. Break it.
To what you were saying earlier about.
Spit it out, son. Here we go.
About elderly people.
He's gonna break.
And my what you claim is my indifference to the pandemic. I just want to remind you that when I went into ITU to intensive care, I saw around me
sleeves rolled up,
a lot of people who were not actually elderly. And in fact, they were middle-aged men, and they were quite like me. And some
all right, come here for an operation, have they? All right, having a kidney fucking sorted, was it?
I tell you,
all right.
In a nutshell, and the NHS, thank God, did an amazing job and helped me survive. But I knew from that experience what an appalling disease this is. I had absolutely no personal doubt about that.
What did you see?
March onwards. To say that I didn't care about the suffering that was being inflicted on the country is simply not right.
Mr. Johnson, I have never suggested you didn't care about the suffering.
Answer the
I
question,
you
man.
didn't care about the reaction to the behaviour demonstrated, a clear reference on the face of that WhatsApp.
Well, I thank you for that clarification.
My lady.
Thank you. Mr. Weatherby, I think you're going to ask some questions, and then Ms. Campbell. I want to make sure that we don't have too long a morning.
I'm happy to crack on as long as you are and the stenographer and Mr. Johnson is.
We'll probably
So
go
if
to
we crack on for about 20 minutes?
Yes,
yeah,
indeed.
1:45, I should think, yeah. We come back about 2. Yeah. Everybody on the right page, everybody? Yeah, what do you reckon? Is he getting a bit tearful there? Emotional fucking Boris.
Mr. Johnson, I am going to ask you some questions on behalf of about 7,000 bereaved family members
Okay, we go
from across England, Scotland,
Okay,
Wales, Northern Ireland, who are supporters of the COVID bereaved Families for Justice UK. a group which
There we go.
eventually you did meet with at one point.
Yeah, we'd be in his head, wouldn't we?
I'm going to ask you questions for about 20 minutes.
We need to be down here then.
Some of the points that I'm going to ask you about have been touched upon by Mr. Keith, so I hope that you and I can collaborate in dealing with them.
Right, I hope you can see that, and the subtitles and all the rest of it. It's all clear.
I want to start, I want to go back to a point that Mr. Keith raised with you about as part of your statement where you say, it's paragraph 15, where you say that the United Kingdom has defied most of the gloomier predictions and has ended the pandemic, or the most serious phases of it, well down the global league tables for excess mortality.
This morning, didn't she, love, eh?
Now, at the end of your exchange with Mr. Keith, my understanding was that you basically stood by that statement. Is that right?
Well, first thing to say is how glad I am that you and the representatives of the bereaved families are here and taking such a big part in this in these proceedings. That's a good thing, and I think it's very valuable for the inquiry.
That's valuable for the inquiry, but the feedback from the meeting that fucked up, you didn't fucking
whatever
apply
the data
the
may
fucking
say,
procedure. I didn't get a fucking occurrence report raised for any feedback. Why
there
not?
were too many. I was merely making the point that I thought that the statistics are they are. I've seen several tables that seem to confirm what I was saying, and I point you to another one by the Lancet, giving roughly the same.
So you read it. You leave the Spectator and the Lancet.
You stand by the statement.
Plug his mate's papers.
Yes. So, as far as I can see, in a very lengthy statement, no problem with that. But you don't actually provide much of a basis for that statement. So I want to just probe it a little bit further.
Say something, but it's based on fucking
nothing. I want
nothing.
to put up a document. I'm going to actually put up a very small number of documents to you in my time, but I do want you to look at this one.
It's
292765, and it's page 10, please.
Hang on a second.
And just while it's going up, this is a graph that's been provided at the inquiry's direction, and it deals with this very issue, and it's the comparative position of the UK internationally. Now, an earlier witness told us that you have some difficulty with graphs, so whether that's right or not, don't worry, I'm going to actually point out the points that I want to raise with you, but I wanted you to be able to see it. But this is the comparative position of the United Kingdom, age standardised for excess deaths with other European countries over the period January 2020 to July 2022. And what it does is it shows that 18 months into the pandemic, it gives two points. It shows that 18 months into the pandemic, the United Kingdom was 9th highest out of the 33 countries in terms of its excess death adjusted. And then it dropped to 15th after 30 months. So it did get better. But the important point that I want to highlight and want fairly put to you with the document in front of you is that only Italy, amongst comparable countries, had a higher excess mortality rate. So it's right that the UK is in the middle of that graph, but in terms of comparable countries, only Italy has a higher mortality rate, and you'd agree with that, I assume.
I don't in that
Okay, well, let me explain then. It's important, of course, that we don't compare apples with pears, as I'm sure you'll agree. So if it's right, your statement, the UK defied most of the gloomier predictions, your words, we would be looking at comparisons, wouldn't we, with countries like France or Belgium or Netherlands, rather than Bulgaria or Poland, which are very different countries. Not deprecating Bulgaria or Poland.
Well, what are you doing with Bulgaria then?
But I'm asking you, if you're going to say that the UK defied the gloomier predictions, then the real comparison is with countries such as France or Belgium or Spain or Germany. Is that right?
Well, if you look at the point I was making, and which I stand by, is that the UK, the tables I've seen, actually comes about halfway down. And it's not just this table, it's the...
See, if you didn't understand this table, did he understand that first table where he's talking about right at the beginning when he said he didn't understand it because he looked the same whether he did this or that?
This is not in any way to diminish the pain and the suffering of people who lost family members during COVID.
I understand that.
However, he still doesn't give a shit, right? And you still don't understand what the fucking graph says.
Enormous effort made by the whole of the UK
Have a look at Boris.
to protect the NHS and save lives.
Can we stick to the question?
And I believe that...
There you go.
Can we stick to the question? You've raised this in your statement. You made a sweeping assertion that the UK defied the more gloomy predictions. I'm putting to you some cold steel of evidence, and that's what I'm trying to do here.
I don't believe that I don't believe that your evidence stacks up.
Okay.
And I think that
well,
actually, if you look at...
Could we just
Go on,
pause,
Boris.
please, Mr. Weatherby, Mr. Johnson? I'm sorry. I know that emotions are running high, but I have to ask those in the public gallery to keep quiet, whatever their emotions.
All they did was breathe in briefly. Come on, Mum.
Affects the live feed, the streaming for other people who are trying to follow.
Yeah, I know,
I'm
you
sorry,
keep moving the
I do
camera around.
understand,
I've got to
but it
play
has
pop
to
music
stop.
in my face.
All right.
Thank you, milady.
Top middle of bottom.
Mr. Johnson,
Rat in
the
a
point
bomb.
I'm getting at is that
There we
you've
go,
raised
go down
this.
there again.
I'm
There we go.
actually now trying to present some
Doink,
evidence.
doink,
The
doink.
inquiry has sought this evidence
no, too
itself.
big.
Now, before you, I'll give you an opportunity to answer.
The
But
Boris.
this evidence is based on ONS, Office of National Statistics
which
material,
can be made to
and
say
Eurostat
anything you
material that
want,
they've got.
everybody.
And
Yeah, don't
there's a
forget
document
that
accompanying this. I'm not going to
statistics, they're
push it
only
up. It's
used
quite a detailed
to
document,
punt
but we've
whatever
provided, it's
narrative
been
it is
provided
you
to
want
the
to
inquiry.
punt.
I'll give it for the
Why
record.
they're
It's
there as a corporation of
271350.
reference.
But that explains the basis of these
extract
figures,
the
the
top
age
part of the
standardisation, which
You wanna
deals with the difference
show
of
and just show
population
that
and
piece. You're going to have
difference of
to show the
age
whole
spread.
fucking thing.
And it deals with the robustness
This
of
is
the
how fucking
international
stupid
data
people
that
like
is
this
used.
geezer are, yeah?
So
Manipulative
these
and
are,
fucking lying, whereas
I'm putting
down
to you
there.
the gold standard of the evidence in respect to this. It deals with
well, it should be
excess
good.
deaths,
They go back- they
not
go-
just
they go down
COVID
there.
deaths.
They go down there.
It deals with excess deaths over the period.
That girl don't like her face being on telly, look. I
You
cover
haven't
that.
put forward any evidence to justify your assertion. Why are you questioning this?
I'm not questioning this. This shows, first of all, this shows...
Because it might be
exactly
fucking
what I said
inaccurate and it
shows,
sounds like
because
it
if you
is.
look at the European tables, we come about halfway down. Secondly, actually, if you look at the data, for instance, that the
Excuse me.
former Health Secretary, Mr. Hancock, cites in his own evidence, the Lancet study, you can see that the UK, France, and Germany and the tables for excess mortality are grouped very close together, and I think Italy sadly has a little bit more, and the Netherlands has a little bit more.
This fucking
Other nations
tag team, fucking
a little
group
bit
up
more.
with the people that are close to you. Fuck off.
The interesting thing for me is how at the end of it all, a prophecy by Chris
Nothing
Whitty
fucking changes
was
at the end of it
correct
fucking all, hasn't it?
he
Hey,
said
still got fucking
that
tosspot fucking
the
shit
UK
back
would
fuckwits
probably
running
end
the
for excess
country and fucking in
mortality
denial and
around about the
refusal
middle
to take any
of the
kind of
pack.
feedback or
and that is
responsibility for the
indeed
staff to
what
do
has happened.
so.
Okay.
And that does
For
not
continual
in any way
improvement, there's obviously going to be
diminish the
amended
individual
forms,
tragedies
amended
of people
procedural
who've lost lives.
fucking
You've said
things.
that, but just dealing with these ONS
it's certain
statistics,
step
this is what the
fucking
King's
forward
Fund
before fucking step
said. Now, the
fucking
King's Fund, as I'm sure you know, is a
whatever it needed to be.
prestigious independent healthcare institution, said well over a century ago. This is what it said. These figures show that although all European countries have experienced devastating death tolls from COVID, and the impacts varied geographically in terms of timing and magnitude, excess mortality in the United Kingdom during the pandemic exceeded that of most comparable Western European
What's it been
countries.
like afterwards?
And it went on. The
Should we-
UK also
don't
had the
forget,
highest excess
check out
mortality
Dr.
rate
John
compared with the baseline
Campbell.
among people under 65 in
Dr.
Western
John
European
Campbell.
countries
Don't
such as
forget,
France,
check him
Belgium,
out.
and Sweden. So I'm going to move on, but I'll put it to you once more.
That geezer looks like he owns an electric car. What do you reckon?
Gold standard of
He looks like he owns an electric car and thinks it's good.
Does not support
what do you reckon?
What you say in your statement, does it?
Well, I think, with great respect, I think that actually it does.
Irrelevant?
And what I was responding to in my, and if you look at the Lancet,
is he being irrelevant?
Document, the Lancet study.
Come on, type
the
faster.
UK is, I think, about
around.
102nd of 190 or so countries. But in a way, I think this argument is irrelevant. All I was trying to do was to. I didn't want the inquiry to run away with the impression that there was something uniquely awful about the performance of the UK's services.
I put the evidence to you. I put it from what I understand the gold standard. I've indicated to you
there is no way
standardised
changing
its excess deaths. One further
people
point
on the front line are powerless
the
because the management have failed to implement
the Johns Hopkins University Institute of Medicine has done a review or a research or per head of population. The UK comes out as number 20 in its global table of 173 countries for COVID.
Can that woman type quiet?
Similarly, the Worldometer website, which is a data set provider, which includes providing data to the UK government, has the UK at number 18 out of 231.
Yeah, but who gives a fuck about your bullshit graph, mate? No one gives a fuck. So we rejected it from the outset. Just because you're going on and on about it, we still think it's bollocks. So why don't you shut up and move into something else, you fucking plank?
And
antagonistic fuckwit
if you look at the
car, there you go. Fuck off. Go and stand by a charge.
Age of the UK population, as I said earlier in my evidence, comorbidities that we sadly have, the density of the UK population.
Well, let's look at that.
I think that.
Has this geezer got a personal vendetta?
The original prophecy of the chief medical officer
Roster's
turned out to be broadly correct.
Okay, well, let's look at that. You raise age and density. South Korea, a comparatively wealthy country of 52 million people.
He's trying to pick hairs
has an
in
older population
statistics from the National
it has a
Statistics
population density of almost
organisation
twice the UK,
or whatever.
And it had a quarter
it's
of
fucking
the UK's
bollocks. You know it's bollocks, I know it's fucking bollocks.
Absolutely.
You can make statistics say anything you like,
people
and that is a fact.
And that is because, in no way to detract from the wonderful efforts of South Korean healthcare, but they already had substantial experience of.
It may as well be an island, right?
Playing SARS and other such diseases, and were well prepared, and arguably better prepared than the UK.
Yes.
To tackle
what does that
something
mean?
like this.
What does that mean? Better prepared.
Notwithstanding what you.
There's no point having 1,200 shovels if you've got to fucking water the garden, is there? Need hose pipe.
You haven't mentioned the United States, which had significantly higher mortality. The UK, given the elderliness of the population, the comorbidities, I do not think it is fair to say that the UK did significantly worse than others.
With respect, that's deflecting from my point, isn't it? By going off and talking about another country. I've given you the full picture here.
This guy's a plank. No, this guy's a fucking idiot. He's exactly the type of prick that I wouldn't want in my fucking office. And he thinks he's being funny and clever.
What happened in March?
He's the sly, oily cunt, that bloke.
Mid-March, wasn't it, that the United Kingdom government
manipulative, fucking argumentative, antagonistic, fucking overweight, sweaty, flabby arsehole that needs kicking round the fucking playground, right? When he was about 6.
As evidenced by much of the evidence,
and he got away with it. He got away with telling somebody to go fuck themselves, and then when everyone don't It's not the reality, that's your reality, your perception of what you're making up out of your bit of paper that you believe in front of your fucking chubby guts, you fuckwit. Go on, Boris. Fucking nail the cunt to the floor.
Anyway, and that it took a while before that had been devised, partly thanks to work done at Port and Down.
Well,
and yes, it is, but yes, and I think it's one of the things that the inquiry needs to focus on is, yes, our diagnostics industry and capability was not strong enough at the time COVID broke.
No doubt.
That's absolutely true.
No
That's
doubt.
One of the
because
legacies,
it's invested abroad through people like Fauci, you fucking knob jockey. And the people that complain about it being in this country are people like you fucking twazzer.
We went up massively in
This
our
geezer
ability
who's
to
fucking
test
questioning
Yes,
the
later.
fucking
people.
Egypt.
By the end of that year, we were doing.
He'll
I think,
try and
300,000
interrupt him,
by
but not let him
September, and
talk
half
when he
a million.
comes out with the
Let's stick to the
truth.
point.
And since you make other comparisons with other,
Yeah, go on, Boris.
Yes.
it is worth bearing in mind.
Okay, but
that
let's
our
stick to the
testing,
point.
our testing ability was by far the biggest in Europe.
Okay.
Yeah.
Going back to the point about South Korea. By mid-March,
See, now he's
South
the one
Korea
that's
had
bringing up
actually
different
tested
countries.
5
And just a
times,
minute ago,
the
he
number of
accused
people
Boris
the
of
UK
bringing
had
different
tested.
countries
And
into
the
it.
reason for
Do you
that
see how he's
was
manipulative,
partly because
yeah?
they had a history of,
Guy's a fucking
of
tosser.
learning from SARS and
It's
MERS, which
exactly the
apparently
type
UK
of cunt
hadn't.
I fucking
But
dislike, and I'll
also,
tell him fucking
because you
straight.
and the
Bloody
government
fuckwit.
had not seen the COVID coming over the horizon. You had
He's
seen
got,
it, but you
he's
hadn't
got a
acted on it.
personal
In
vendetta.
paragraph 46
that
of
bloke.
your statement, looking
white.
back, it's clear that we vastly underestimated the risks in those early weeks. If we'd properly understood how fast COVID was
listen
spreading,
to his
the
voice.
fact that it was spreading asymptomatically,
Oh,
there are many things we would have done differently. If we realised
don't wait
what this
yourself,
virus
yeah.
could do, then we would have immediately laid down stocks of PPE.
Yeah, that's
checked
in
PHE
hindsight,
had
you
diagnostic
pillock.
abilities, started
What
the
are you
race for
going
a
on
vaccine
about?
and
You
started to
paid
socialise
liberal
the
fucking
public
twat, is
with
he?
the idea that they
You
were
ain't
going to have to
Kira's
do
fucking
NPIs.
bum
That's
chum or
your
what? You reckon?
own words that
Yeah.
you failed to act on things like
Yeah, it's in
ramping up
hindsight,
testing
you
and PPE
pillock.
Sorry,
until it was
You
too
can't.
late.
So what my words say is that
So after
we
the
didn't
event,
know
you twat.
at the time
What
what
a
we
prick.
needed to do. Even
He's the type of
had we
people
known,
that make it
even
impossible
had we known,
to achieve
we
fucking
would not have been
anything.
able in the time
Yeah?
available
'Cause he'll
to
do
build
it
up anything like
just for the sake of doing it and try and make himself look clever.
capabilities that were
Sit
necessary
the
for,
fuck down, you prick.
a test and trace scheme, and
Fucking
the test and trace system
More
was
respect for fucking Boris and that
rapidly
bloke stood there. I bet
overwhelmed
he's
in
Kieran's
every
fuck-
European
Kieran's
country.
Well, the
fucking
problem is you
Keir
hadn't got
Starmer's, mate.
started with it, Mr. Johnson. That's what you're saying in your self-reflection in your statement, isn't
Well,
it?
yeah, you wouldn't have
The
got started
reality
because you
is-
didn't know about
No,
it
that's
because it
not
was
true.
at the beginning, not at the end, you fucking
We had a
idiot.
test and trace
Fucking hell, it's like he can't read a fucking
And we
storybook
could
and figure out
already
which is the beginning,
test
which is the
test
end.
and
He
trace
wants to
people.
muddle it
But it
up.
was nothing like
Fucking
big
idiot.
enough. And
Well, where's he
what I
going
hope
with
will
it?
be one of the
You
legacies
should
of
shut
this
him down, tell him to shut the fuck up in a
exercise
minute, or
is
what?
that we will have a
Penis.
much bigger diagnostics industry, as indeed we now do.
But the reality is that
Oh,
your
no,
government was
is it reality?
reactive,
You keep coming up with this
not to
genetic
what
shit,
was on the
generic
horizon,
crap.
but what was there in the here and now. And you just reacted too late to provide PPE, source PPE, or source testing. And isn't that the reality of it?
No,
No,
because that's at the
as soon as
beginning,
we
you
understood the
twat.
scale
He's
of the
now
problem,
saying
we-
straight no
we
because the
shifted
geezer's
heaven
being
and
a
earth
prick.
to get both
Yeah?
things.
By-
I think by the
Yeah,
end of
and the geezer's getting
of
red,
the-
mate,
of
because
the
he's
year,
fucking
I
not
think
getting away with it.
something
He's a
like
fucking
35
penis. Whoever
billion
employed
items
him
of
needs to
PPE.
By
fucking
the
boot
5th of
him down the
April,
road,
the
man.
BBC were reporting, still
That's
on the
it.
website.
You grab your hands,
Headline,
pal.
coronavirus, the NHS workers wearing bin bags as protection.
Yes.
3 days later, the Daily Telegraph ran a similar article.
Yes.
Even after the first lockdown had started, you were woefully short of PPE and testing.
But had it
because
been
you
ordered?
hadn't reacted
Had
when
it been
came on
ordered?
the
Had it
horizon
been
in
ordered, or are you
January.
just
Ramped up testing
picking
capacity,
articles
ramped
from
up
random left-wing,
No, so
liberal
even
fucking
if,
attacking
we'd
fucking
appreciated
websites,
in-
or
and
what?
I've told you, I've explained
What's a
that,
penis? Get him off.
we didn't understand the scale and the pace of the virus's advance.
Yeah.
But even if we
He's talked about the
had,
peak and when he found
I
out
don't
about
believe
the
that it
peak
would have
and how they
made
reacted to it.
that much difference in January, because the stocks were not great around the world. And if you remember what happened,
Everybody grabbed everything.
Terrible situation in March when there were struggles virtually at airports over consignments of PPE to make sure they went from one country rather than
the documents show that at the beginning of March, which is when you first started to chair COBRA and you went to the hospital shaking hands with COVID patients at the beginning of March. That the CCS, Civil Service Secretariat, was still scoping matters such as PPE and testing. By the 26th of April, into a month into the first lockdown, there's a private email between you and Dominic Cummings, where you say that the T&T, the test and trace plans, were, quote, whistling in the dark with, quote, legions of imaginary Clouseaus and no plan to hire them, and an app that doesn't work. And finally this,
What's
quote,
that got to do with
turn it around. That's what you were saying a month into lockdown about testing.
Well, what I was also being told, if you think about the evidence that had been given to me to begin with, I was being told that we did have a very good test and trace system. I was told that we had ample preparation, and that turned out not to be true. So what you're rightly quoting is me responding to the reality and telling the system that we've got to go up several gears and sort it out.
Just for the record, the reference is 226, 628 at page 21. But what you're doing there is you're saying the stable door's open, the horse is bolted, and you're realising that there's no plans in place to ramp up the testing. You've told us this morning that in early March...
That isn't what the document says. That's you twisting what that says.
Part of the reason for that is that the UK didn't have enough tests.
Sorry. The UK's diagnostics...
He's trying to mix tests and PPE, right, and timing, and that fucking thing there, all into one, and it ain't working.
Because
it ain't working, pal. It ain't working. Get him off. Send him down a job centre.
Chief Medical Officer had to say what Yvonne Doyle had to say. At around that time, you can see that they believe that we have a big testing capability.
Okay.
And that was what I was picking up.
Yep,
that turned out not to be true. We reacted. We then set up one of the biggest testing. Well, I think probably certainly the
too many fucking yes men and
Europe.
Girls.
And
I will do that.
Very much for everything that she did.
Not yes, it's done. It's yes, I'll do that.
And I also
doesn't mean it's done.
What we did on
who and why are people running around? No, you're deflecting it.
I'm going to move on to the final point, if I may.
And I'd
like you to look, it's a different point.
You might like me to do something, but I've also got the fucking inclination not to glance at it at all. Just get it out of your face, you fucking chubby, sweaty little balding cunt.
Now this is
fucking hate people like
September. Mr. Keith's dealt with much of this, so I can deal with it very quickly. This is a page from Professor Valence's diaries relating to that day. I'll read it just through quickly. 11th of September, schools data reviewed on the dashboard. You say, what am I being told? Is this a great triumph? Mr. Hancock says, yes, a great triumph. Professor Valence comments, care homes upward spiking cases over the past few days. Here we go again. You say, and this is the critical point, or one of two critical points here, you say, we need to remember the grim history of March. And then Professor Valence called for a package of actions. Mr. Hancock refers to care home winter plan.
Yeah, you've loads of different points
everyone
in there.
Says the rule of six is so unfair, punishing the young, but fuck you, Daily Mail.
I apologise for my language.
Okay, well, it's in shouty capitals and underlined.
Well, not by me.
By Professor Valence. look, this is all about stopping deaths. We need to tell them. Hospital
You've got
admissions
Boris
are clearly beginning
apologising
to
there for
increase.
things he ain't done.
First of all, do you recall
the other
this
guy
and the flavour of it
could
being
have
accurate?
controlled himself, but
no,
didn't.
but what I can tell you, if indeed it is accurate, is that what I would have been saying is that this is September.
Yeah.
We're in a. You can see as I was saying earlier to Mr. Keith, to the inquiry, you can see the risk that the virus is going to start taking off again. I'm
Yes.
extremely
That's
worried.
exactly what I'm putting it for to you for.
And with great respect to you, sir, it looks to me as though what I'm saying here is that the priority is to, and I'm sorry to have said this about the Daily Mail, but the priority is to stop death.
Well, wait for the question. You were there recognising that we were back in a position not dissimilar to March. You're also recognising, with the reference to part of the media, that you've got competing pressures, aren't you? That's what's going on. So you're saying let's look for a package of measures.
Right?
I just for the avoidance of doubt, I don't think that this is meant to be a general criticism of.
Yeah, it's just the geezer's an arsehole.
I'm not suggesting it is.
Press, the Daily Mail.
No, but you're trying to fucking push it. You're trying to turn it into something that it isn't, aren't you? You fucking antagonistic prick.
Here you're
Yeah, like I say, when he was younger in the fucking playground, their fucking other kids should have sorted him out,
which I
and
then
they never did they?
No, I say
didn't.
that we've got to have the rule of
that's where I'm going with this, Mr. Johnson. You're recognising you've not got your head somewhere else. You're recognising the problem.
Yeah.
You're back in a position not dissimilar to March.
Yeah, but we're in 10 times the fucking problem, you plank.
And you're recognising there's opposition to that. So you've got this tension.
There's always
That's
opposition
right,
because fucking people like that.
Yes, exactly.
So what's your point, you plank? What's your point? What's your point?
But I hope
what's your point? What's the fucking point?
So ably understand. My priority was saving lives.
But then we get to the 21st of September with SAGE recommending this circuit breaker. Just 10 days later, circuit breaker with a attached package.
Yeah.
And
says action implemented.
You go with a tier system,
once it's been analysed.
Back to SAGE. SAGE never gets to look at SAGE.
Great respect. I think I can repeat if you like what I said to the Council for the Inquiry, but the gist of it is that
Jesus, terrible.
I thought there were downsides to the proposed circuit breaker. It wasn't as simple as all that. It was immensely destructive. The risk was you'd have to keep doing it, as they themselves acknowledged.
It's not not your judgment to make whether it was or wasn't, mate. So stop saying yes and butting in, you cunt.
For a while was to see if we could intensify the national measures and then go to,
yes, you've said that. Just this before I sit down.
Yes, I have. And like you tried to say,
is that you understand the problem.
You're
caught in this tension between two sides, and you delay, and you're indecisive. And the actual measures that bring R down eventually are punted off.
What's that got to do with PPE then, mate? What's that got to do with your PPE question? Fuck, yeah, see? You're a twazzock, mate. Fuck off. Tell him to fuck off. The judge needs to tell him to fuck off.
I don't think it stacks up.
Yeah,
I think if you look
he's a
at
fucking idiot. Tell him to go fuck his nan's fucking titties.
The timing of events in March, the sequence of things that we did, then the sequence of things that we did in September, October, November, they were reasonable. Our priority was to protect the NHS and
go and
save
suck
lives.
eggs, mate.
By the way,
unlike
some other countries,
go and eat
we
another
did not
fucking
have
ration
our
in the
system
fucking thing.
overwhelmed, and in that respect,
Make
at
sure you
least,
roll for the train
in that respect,
mate.
unlike the scenes we saw in some other countries, the healthcare system was not overwhelmed in this country, and in that respect, I think that the efforts of the British people paid off.
Yeah, well done, Boris.
Thank you very much. We'll break now. The stenographer's had too long.
Right, there we go. There we go. Bring me yourself over. Thank you, Mark. Thank you, Mark.
When you do answer the questions, I appreciate it's very difficult, but keep your answers slower because
I will.
People are trying to type the shit out.
And
yeah.
I don't want to have to repeat my warnings. Please heed what I said this morning, because otherwise I'm going to have to ask other people to leave, and that is the last thing I want to do.
Oh dear. All rise. Right, they fucked off for a bit. She didn't tell us when they're coming back. Right, I'm assuming 2 o'clock. Yeah. Hello everyone, I'm Dodgy Git. This is Dodgy Git Show 114. Day 2, part 2 of Boris at the Covid inquiry. Now, we ended there and I got a bit fucking angry with that geezer, see? I've had to deal with people like him before, and they are fucking obnoxious arseholes that just drive you to want to be fucking exceptionally violent. Yeah? Yeah? He's asked him to agree with him. This is all the geezer's done. Asked him to agree with him and wound him up doing it. Because he's trying to suggest a load of other things. He wants him to say yes. Yeah? He'll get him to say yes, 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 and then he'll ask him a question with a no answer. But Boris is in the yes, yes, yes mode. It's antagonistic, fucking obnoxious arsehole that usually doesn't allow a company or business to progress anywhere. Yeah? Because whatever you say, they'll fucking come back with some fucking stupid excuse. Yeah? Because it'd be just as critical if Boris had done nothing. There was inaction. Yeah? He's trying to suggest there was inaction, but it wasn't inaction because he's running every day with the different information that's coming in. Yeah? So when he writes a document in hindsight to something, he certainly can't be held to account for fucking what happened back then and why didn't he do what you know now back then. Well, it's fucking obvious, isn't it? Why are you even asking the question? It's literally wasting people's time, everybody's fucking money, yeah? And you're getting nowhere. You're producing nothing from it. Anyway, I hope you've been enjoying it. It's been quite funny. Just seeing the way pricks like that ask questions, yeah? I fucking hate guys like that. Fucking do my nutting. Yeah? The other geezer I could get along with. Yeah, you could stand at the bar and have a chat with him. Yeah, that flabby little cunt needs to fucking, yeah, wouldn't fucking, and I bet he drives an electric car. Well, I hope he lost a shitload of money doing it, right? It's 3 minutes to 1 here on the 7th of December in the UK. It's about to piss down with rain outside already. It looks like it's going to snow, but it's too warm to snow. But there's a big fucking rainstorm coming, right? So we'll say that, what do you call it? Why do I always forget how to address them? Her worship, yeah? We'll take it that her worship's having dinner for an hour. She's gone to the buffet, and she's gone to the buffet. She'll get a shepherd's pie or whatever. Yeah, shepherd's pie, a bit of veg on the side, yeah, maybe a salad, yeah? And she'll go and sit there and have a meal. And then we'll all come back about 2 o'clock. And we'll do a show 115, Dodgy Git Show 115, right? So we're coming up to an hour and a half. That's fair enough, isn't it, eh? Everybody needs a wee, a cup of tea, yeah? Put on the TV and catch up with what they reckon about Boris, eh? And the way that people ask the questions, because now what we got is in the court, you got an antagonistic arsehole asking a question and getting a response, right? But now what we're going to have is the fucking news spinning what both of them have said. So we'll carry on the theatre show, right? By going and watching the fucking news now and having a spot of fucking lunch, I think. I think it's lunchtime, at 1 o'clock. So, as per usual, I thank you from the bottom of my heart for joining me, Dodgy Git, at the Dodgy Git Show. Well, this was Dodgy Git Show 114. Join me again in an hour for Dodgy Git Show 115, where we'll be joining Boris again for part 3 of today's day 2 at the COVID inquiry. I'm sharing my love with you, so you've got some love in your heart to share with the people around you, right? Do your neighbour a favour, do somebody something for nothing. See you in an hour, everybody. Thanks for joining. Please leave your comments, like and subscribe, and then you'll get notified in an hour's time when I'm coming back live. Lots of love. Bye 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 bye.